Hello everyone, welcome to the channel. In this video, we will learn about the Anemia Mukt Bharat program, its strategies, objectives, and how it is being implemented across the country. Anemia is one of the most common health problem in India that is affecting children, adolescents, and women of reproductive age group. So to tackle this issue, Government of India has launched Anemia Mukt Bharat in the year 2018 by the Ministry of Health and Family Welfare. In this slide, we will learn about the evolution of various programs which are related with the anemia. First program was launched in the year 1970. The name was National Nutritional Anemia Prophylaxis Program. So in this, the focus was on prevention of anemia. Then in the year 1991, it was named as National Nutritional Anemia Control Program. So in this, the focus was on prevention part, plus the focus was also on the treatment part. So even after so many years, in the 2013, anemia was still a huge problem. So the government launched a more comprehensive program that covered all the age groups, and that was named as NIPI, that is National Iron Plus Initiative Program. So in the year 2018, the intensified NIPI, that is Anemia Mukt Bharat, was launched. So that program is more comprehensive, and it is involving multi-sectoral approach, involving 6x6x6 strategy. So we have consolidated what we have learned in the previous program, and a convergent approach, multi-sectoral approach was used. Mukt Bharat has 6x6x6 strategy that includes 6 beneficiaries, 6 interventions, and 6 institutional mechanism. 6 beneficiaries means which are our target group in which we are targeting our interventions. Intervention means what we are doing to tackle the problem of anemia, and in institutional mechanisms provide the policy direction, and that will also help in intersectoral coordination, and that will also help in program oversight. Objectives of Anemia Mukt Bharat is to reduce the prevalence of anemia by 3 percentage points every year among the children, adolescent, and the women of reproductive age group. Apart from reduction of anemia, objectives also include strengthening of anemia prevention, screening, and treatment part across the different population groups, and to ensure a regular IFA tablet consumption, and to address the other non-nutritional causes of anemia. So 6 beneficiaries which are included in this program are children aged 6 to 59 months, children 5 to 9 years, adolescent group including both the males as well as female, and both in school and out of school adolescent. Then we have women of reproductive age group from 20 to 49 years of age, pregnant women, and lactating mothers. These are the 6 interventions which we'll see in detail in the later slides. And these are the 6 institutional mechanisms for the implementation of the program. Coming to the interventions first. So first is the iron folic acid supplementation. This is the target group, and we can see that in adolescent age group, in women of reproductive age group, and in pregnant and lactating mothers, the concentration of elemental iron and folic acid is same. So all these age group, it is 60 milligram elemental iron, and 500 microgram folic acid. All this is a MCQ question. In children from 5 to 9 years of age, the elemental iron is 45 milligram and the folic acid is 400 microgram. In children 6 to 59 months of age, it is the elemental iron is 20 milligram and the folic acid is 100 milligram. In children below the age of 5 years, it is given bi-weekly and it is given in the form of syrup. First dose is given by the Asha herself in the front of mother, and she also trains the mother to give IFA supplementation to the child. In children 5 to 9 years, it is given weekly and the tablet is of pink color. In adolescent, it is also given weekly and it is of blue color. In women of reproductive age group, it is given weekly and it is of red color. It is to be given 180 days during pregnancy and at least 180 days after the delivery. So, in children under the age of 5 years, it is given in the form of syrup and it is bi-weekly. Then in children, adolescent, women of reproductive age group, it is given weekly, but the color of the tablet is different. It is pink color in the case of 5 to 9 years. It is of blue color in the case of adolescent and it is of red color in women of reproductive age group. In pregnancy, it is given daily. And we have to remember here that this is a prophylactic dose. Once daily is a prophylactic dose. If a female is anemic, then we have to give this tablet twice. So delivery mechanism is for children under the age of 5 years. It is given through ASHA and Anganwadi workers during home visits and village and health nutrition days. For school going children and adolescent, it is given under RBSK program. For out of the school children, it is given through village health clinics and through adolescent health days. And for pregnant and lactating mothers, it is given during ANC visits and village health and nutrition days. Second important intervention is the biannual deworming through albendazole tablet. And the objective is to reduce the intestinal worm that contributes to iron deficiency by preventing the proper absorption of nutrient. Deworming, we are using albendazole tablet of 400 mg strength and it is given twice a year on National Deworming Days on 10th of February and 10th of August. In pregnancy, one dose of 400 mg is given after the first trimester during ANC visit. In rest of the cases, 400 mg tablet is given, but children aged 12 to 24 months, it is given in the form of half tablet, and after the age of 2 years, one full tablet is given. Act of deworming, it reduces the parasitic infection that will prevent the chronic anemia and malnutrition. It will also improve the iron absorption and overall health status of the child. Then third intervention is intensified year-round behavior change communication, BCC campaign, solid body, smart mind. So in this objective of the government is to promote the awareness and to promote the behavioral changes regarding anemia prevention. So in this, the government want to encourage people to adopt a healthy behavior which is related with anemia prevention, nutrition, and so that people should learn habits which can prevent anemia in the long run. Second is the inclusion of iron-rich food items, green leafy vegetable, pulses, meat, and other fortified foods in the diet to increase the consumption of iron. So the people should take more diverse diets. Third is the hygiene and sanitation like regular hand washing, deworming, and safe drinking water. And most important, delayed cord clamping, that is encouraging a delay of at least 3 minutes. This is an MCQ. after the birth to increase the iron stores in the body. So, in delayed cord clamping, instead of cutting the umbilical cord immediately, it is being delayed for at least 3 minutes. This allows the extra blood, which is rich in iron, flowing from placenta to the newborn. That will help in boosting the iron stores and it decreases the risk of anemia in infancy. Expected impact is the improvement in the adherence of IFA supplementation, encourages better dietary habits for the prevention of anemia, and also encourages the community participation in anemia control. Then fourth is the testing and treatment of anemia using digital method that will help in ensuring the early detection and prompt treatment of anemia, particularly in the pregnant women and adolescent. The target group includes the school going adolescent, and in them the annual screening by the RBSK team is done using the digital hemoglobinometers. And second, in the pregnant women, that all the ANC visits using digital methods at high load facility. So if there is mild to moderate anemia, then the oral iron supplementation is done, and if there is severe anemia, hemoglobin less than 7 gram per dl, then the patient is referred to the higher facility for either the blood transfusion or the IV iron sucrose if needed. Testing and treatment of anemia using digital method will improve the early detection of anemia, and it ensures the timely treatment and the prevention of complications. Then fifth is a mandatory provision of IFA fortified foods. Through this, the objective is to improve the iron intake through staple food fortification. The fortified foods are provided in the key government nutrition programs such as ICDS and midday meal scheme, and there is a mandatory fortification of staple foods like salt, wheat and rice, which are being fortified with iron, folic acid and vitamin B12, and fortification of edible oils with vitamins A and D. Expected impact is to provide a continuous dietary iron intake to prevent anemia and to address the micronutrient deficiencies which are prevalent at the population level. Then 6 is the addressing the non-nutritional causes of anemia. So in this, the government want to tackle the other medical and environmental causes of anemia like the malaria, hemoglobinopathies and fluorosis. So for malaria, there is a screening and treatment in the endemic areas and the promotion of long-lasting insecticide-treated bed nets. For hemoglobinopathies like thalassemia and the sickle cell disease, there is a screening for high-risk group and the genetic counseling for affected families. For fluorosis, there is a provision of safe drinking water and dietary interventions to reduce the fluoride absorption. Institutional mechanism. In institutional mechanism, first is the intra-ministerial coordination. That is a lead ministry. Here is the Ministry of Health and Family Welfare. The other ministries which are involved is the Ministry of Women and Child Development, Ministry of Education, Ministry of Rural Development, and the Panchayati Raj. The purpose is to ensure the convergence of multiple programs like NHM, Midday Meal Scheme, Poshan Abhiyan, and to address the supply chain monitoring and the program effectiveness. Second is the after the intra-ministerial coordination, there is a convergence with other ministries. So in this, the integration within the Poshan Abhiyan framework to ensure the multi-sectoral approach. So here the coordination is done with the education sector for the IFA supplementation and deworming, the coordination with the women and child development sector for ICDS program, village health and nutrition days and maternal nutrition program, coordination with rural development and Panchayati Raj. Then we have a National Anemia Mukt Bharat unit. The purpose is to oversee the implementation of Anemia Mukt Bharat at the national level, to develop the various guidelines, training modules and the communication strategy, and to support the state in program planning, supply chain management and the monitoring. Then we have a National Center of Excellence in Advanced Research on the Anemia Control. It is being located at the AIIMS New Delhi, to provide the research and policy support. The key functions of this center is to conduct the operational research on anemia, act as a reference laboratory for anemia screening and diagnosis, to develop training materials, and to provide capacity for health workers. Then we have strengthening supply chain and logistics. Ensure the uninterrupted availability of IFA tablet, deworming drugs, and testing equipment. There is a centralized procurement and the multi-year rate contract for IFA supplementation. There is inclusion of IFA and albendazole in the essential drug list, and integration with drug and vaccine distribution management system, that is e-Aushadhi. That will help in the real-time stock monitoring. Mukt Bharat digital dashboard. It is a digital portal for the real-time tracking and the reporting of Anemia Mukt Bharat progress. So that will help in maintaining the quarterly progress report, providing the state and the district level performance ranking, and to serve as a data repository from program managers and the policymakers. So this is how the dashboard of Anemia Mukt Bharat looks like.